get grant money to do a de jure census, a Ibarakwa Central and Health Census, to establish chronic diseases, to provide health service to people where they live and work, in their homes, in their farms, in their shop. Nobody lives in a hospital or a health center. A health center is not community medicine or community health. When UCH started, we also, Kolada IC came to partner. We also did the same thing for Yemetu Allah Dorin. But political will never allowed any of those to be practiced. So when Okonofo allowed me to come here, we started doing that. And I explained it to the young fellows here. And they went to choose these 3 local governments, totally urban, peri-urban, and rural. So when we established community-owned health service, if community doesn't own it, you are just visiting, you are not doing anything. You won't survive after you. So we set up to do it. So they'll be telling the story how they've done it. I don't do more than advice on what they're doing and explain, so that if I die or get out of here, it will continue. It won't be Professor Susie. So wherever they are, we hear what it is and what we're going to do. Luckily, Dr. Popola, who is the current director of the Ibarakwa program, and I think he will be the 3rd longest serving coordinator of studies as well, is here to dot the I's and cross the T's. So I'm happy to be here, happy to see all of you here. Any department, if we establish this institute that works well, any department in this university that doesn't come to Keigbo or to Efore or to Iletutu to say, I'm an engineer, I want to make sure all the roads in this place have gutter, so there's no Ogunkwa flood here or anything like that. Or I do agriculture, so I want to help all the people here on a continuous basis. I'm sure they'll be explaining that. Nobody here cannot come to any of these communities on a continuing basis. And when they are getting old, they tell person who succeeded them to do that. So thank you very much for being here. And I hope that you will be agents to what they'll be explaining to us that we'll be doing over time. Thank you very much.
Thank you very much, Prof. Please a round of applause for Prof. The second remark we'll take coming from Unimed. The other one will come from Unimed Teaching Hospital. I call on Professor Akin Bodewa to give us a very short remark in the next 3 minutes. Please a round of applause for Professor Akin Bodewa.
Good afternoon, ladies and gentlemen. The Vice Chancellor, Professor Adeshegun Fatusi, the Deputy Vice Chancellor, Professor Mrs. Rose Angela Nwuba, and because of time, all other principal officers, the royal fathers here present, we want to say thank you for coming. Key officers from Unimed Teaching Hospital, the PAMSEC Hospitals Management Board, Dr. Ayodele Adiji, and of course, Dr. Ademu Jimi, and the DG of Ondo State Contributory Health Commission, and every other important personalities here present. I am Professor Akin Bodewa, representing the CMD, Unimed Teaching Hospital, who is unavoidably absent due to other key assignments. Let me seize this opportunity to speak on his behalf to congratulate the University of Medical Sciences and especially the Department of Community Medicine for this great initiative. We'll not be surprised because of the little time I've had with Professor M.C. Asuzu. He's always spoken about carrying clinical services to the community. He has called me aside more than a year plus, saying, Akin, you have to take nephrology to the community. And I said, sir, that's what we have been doing. This much was evidential yesterday during the inaugural lecture of my colleague, Professor Adejumo. See how we've been going to the community. But I assure us today that as we discuss, a lot more will be unveiled. Like they say in Yoruba, so in closing, let me say that Unimed Teaching Hospital is in line with the vision of Unimed and in particular community medicine, because part of the law establishing Unimed Teaching Hospital talks about carrying clinical services to the community. In the world of nephrology, our mother association globally, that is International Society of Nephrology, has identified the key role of primary health care in combating chronic kidney disease. And as I speak to you, we are working seriously with communities, not just health centers, to see how we can deliver kidney care, both prevention and then, of course, interventional in the community. Thank you for this opportunity.
Thank you very much, sir. Right now, we'll make the opening remarks that will set the tone for the discussion of being the Vice Chancellor of the university. A professor of community medicine also is about to talk to us, and I hope we are ready. Please fasten your belt as I call on Professor Adeshegun Olayiwola Fatusi to set the tone for our discussion today.
Thank you. The KBSs, our distinguished guest speaker, my sister, friend, and colleague, Professor Sanjila Ngubaya, DVC, my brother and colleague, Professor Akinbodewa, somebody says grandfather of public care practice here, Professor Suzu, who I always say was my supervisor when I did my West African College of Physicians at Part 2 back then in 1995. And the director of our program, Dr. Shumakanwa, who incidentally also happens to be the former executive secretary of the State Primary Care Development Agency. Distinguished ladies and gentlemen, let me start by, first of all, I hope this is not breaking the protocol. My understanding of what we are doing is that this is a relationship that is multidimensional. We have our university, we have the teaching hospital, but we also have the government as key part of this. Because, like Professor Suzu said, nobody lives in the health center, but somebody owns the land, and somebody pretend over it. So permit me to quickly recognize two people and ask them, please, probably they should take my share. Dr. Adiji is here, the director, the permanent secretary of the state, the health management board, the hospital management board. Please come to the table, Dr. Adiji. We have Dr. Isaac Aladini, who is representing the permanent secretary of the Ministry of Health. Isaac, please come to the table. If there are not enough shares, please look for enough shares. So we have the government, we have our institutions, and we have our traditional institutions who are already fully represented. I just think that's the fairest way to balance this if it's truly a partnership. Let me also specially recognize the table. And last but not the least, let me also recognize two other people, even though I may not be able to call them to the table this morning. I wish I could. The first person is Dr. Demlade Ibirongbe, who is actually the head of community medicine. Most of our work out there in the community is anchored by community medicine out there in Ilututun and what they're doing. And in our vision for what we want to be going forward, we have designed that Bolondro campus will be the hub for our community agenda. And the director of that campus is here this morning, Dr. Victoria. All right. I haven't done that. I'm just going to spend a few minutes. I want to just welcome everyone and to thank the Institute for putting this together. I want to ask you to look at what the topic is. It says, Unimed and community service to this reality and define the agenda for tomorrow. So, to my understanding, this is not about the Institute of Community Health. No, it's not about that. This is not about realities that we have in our motto, our motto is for learning and community service. The dynamics in this room tells me there's a very terribly poor understanding of what that motto stands for. And it reflects in not only what we do, but also how we do it. And that was why I was hoping that this meeting would be like a turning point of some very honest discussions and about some rethinking about what needs to change, and how it needs to change. I was telling my deputy vice president that there's so much I like to say to this morning, but I really don't want to say much. But so I'm just struggling my heart. But let's start with this. When the founding fathers thought about this institution and said our motto is going to be for learning and community service, there must have been something in their mind. They must have understood that when we don't fulfill the community dimension of our mandate, we are not passing, we are not succeeding, we are truly failing. We might congratulate ourselves. We have graduated 3 sets of doctors. It's okay. We have graduated 3 sets of tourism. Very good. But where is that connection with the community? I am not saying there is none. I am saying whatever we have done, I don't think we have done sufficiently well enough in that dynamics, in that dimension. Of course, as an institution, one of the things we have tried to do in the last couple of years is to connect with the community life in some very tangible ways. I'm not sure there are many universities that runs the kind of program like RUN. For example, the science, technology, engineering, mathematics program, where we fund secondary school students to annually develop some innovative things. We just gave last week, prizes, 750,000 to the first school, 500,000 under school, and all of that. I'm not sure there are many schools that are organizing. Thank you. There are not many schools that are organizing competition for primary schools in the environment, just to help young people develop. I'm not sure there are many schools in this country that are doing the kind of work we are doing in Lututu and working with people but that is not enough. That's the reality. It is just, for me, the scratching of the surface. I always tell a story when it comes to medicine and public health. And I hope that, let me tell this story. I always tell that story. That, those who are working in the field of gynecology, that's, there's an heroic dimension to what medicine is. And I always think that it's like you see a bridge, you are going from one community to the other. I don't know where I read it many years ago. You are going from one community A to community B, and the bridge is broken. And what do? What the typical physician would do is he puts on his gear so that when somebody falls into the water, he dives in and brings him out. That's the mentality of a typical physician. Somebody has kidney failure, let's look for machine. Somebody has ruptured uterus, let's go to theater. Somebody has a chronic obstructive pulmonary disease, let's put him on drugs. I hope I'm not picking on individual. I think I'm just looking at the room and look at what the place is here. And somebody has glaucoma, and let's. But if we repair the bridge, won't we save more lives? Rather than dive into water endlessly, trying to rescue people. Which is what the medical paradigm has been all the while. I'm not saying we will never need doctors who will rescue you, but think about your community practice. You are nutritionists, you are trained nutritionists, and then they can't go to the villages to assess the nutritional status of our people. They are not able to go there and educate the people on how they can use their own local food to improve their health. So of what essence is our presence and our training? Forgive me if I'm sounding very critical. The agenda for this is to say today's reality and define the agenda tomorrow. If we don't tell ourselves the truth, we cannot define a pathway to the future. A couple of, last year or thereabout, I called the head of the Department of O&G One of my own security men, the wife died of pregnancy-related disease, my own security. And I called them like, how can I be here? And the man who is going with me every day, his wife still was pregnant, will not come to the hospital, will go to the, and that in itself is an indicator that we have failed him, his family, his community. And so, friends, I'm going to leave you with a thought this morning to say, if we behold the future from the perspective of a school that understands that its motto is not to produce doctors, produce nurses, but for learning and community service, what will that picture be in our mind? And that picture is not a picture that can be fulfilled by the Institute of Community Health. It can't. They can only be catalysts in trying to drive an agenda until we all across our programs embrace that understanding that our training is incomplete without embedding, I'm not saying giving lecture, without embedding our students with a sense of what it means to have community service. We are not fulfilling the mandates of the founding fathers. And so, I will end with sharing with you what we believe is part of the way to the future. As many of you might recall, years ago we had Ondo as the base for our School of Public Health. And we said we are reprofiling, we are redesigning our program. And we said Ondo will become our center for training center for research and training around what community health services will be like. And we felt that every program will have their students to rotate to Ondo for a couple of weeks. And while they are there, they are going to work in the community and work with the people so that they understand the community, they understand their needs, and they understand how to mobilize the community to help itself. We cannot help them without them helping themselves. And they will come to understand how you can use the law to work with them to improve their own life. Once we are not getting that right, we are not getting it right. And so I hope that as we move forward, we begin to honestly ask the question, how and why, how and in what way we need to transit from what we have today to become what our founding fathers has dreamed will be. A school where community service is at the center of our thoughts and our actions. I do hope that today will be the beginning of a conversation. I know it cannot be the end of it. I want to thank you for being present.
Now the tone is set. When I was bringing the Vice Chancellor, I said you should fasten your belt. And you could see what he had done, giving us some historical antecedents into what we are doing today, why it is so important, and also giving us very key word that truly if we have something to achieve in the future, there's a need also not to leave the students behind. They need to understand why we are doing what we are doing. I was initially saying the connection just between the TAN and GAN. The VC has taken it far beyond that, and telling us it's actually multi-dimensional and bringing the government concept into it. I knew for us to have had the permanent secretary in our midst, we will also be looking at another dimension. Now the tone is set. We want to take some presentations. These presentations will be dwelling more on what we have heard from the VC. Now we want to expand the scope of what we are trying to do. And to lead the first presentation, to give us the first presentation today, is Dr. Oshunmakinwa. And I will be calling on Dr. Gbemisola. So please come around to read the citation of Dr. Oshunmakinwa, who will then take this first presentation.
Oshumakinwa is a lecturer 1 in the Department of Community Medicine, University of Medical Sciences, and currently the director of the Institute of Community Health Innovation and Development of the university. He graduated with an MBBS 1994 and master's degree in public health from University of Lagos 2000, master in business administration from FUTA in 2002, and in epidemiology and medical statistics from the University of Ibadan in 2004. His research interests include primary healthcare system development, epidemiology, and development. Okay, please join me in welcoming our speaker as he leads us in the presentation. Thank you.
The Vice Chancellor of the university. I would like to play safe by standing on the existing protocol. However, I want to specially recognize all the principal officers, the permanent secretaries, deans, and then community leaders, the KBAC, and the high chiefs. And then want to also appreciate the keynote speaker. Good afternoon, sirs and ma'ams. My job has been made the... Yes, sir. Kamisi, you're welcome, sir. So I'd like to also acknowledge the efforts of Dr. Bolu Adeboye, who came all the way from Lagos. My job for this presentation has been Symposium is Unimed and Community Service, today's realities, and defining the agenda for tomorrow. And the key objectives of this gathering primarily includes: 1, to create awareness about the existence of the Unimed Teaching Hospital community-based healthcare services, which has been on at least in the first local government for about 3 going to 4 years now. And we also intend to use this forum, this symposium, to promote the integration of the Unimed and Unimedth teaching hospital professionals, medical and health professionals, integrating them into the community-based healthcare services ongoing in the 3 local government areas of the state, and to as well draw lessons from a similar program which has been up and running for decades in our sister university, University of Ibadan, which the keynote speaker will be highlighting and bringing forward. And then to also chart the way forward as it concerns this process of integrating the medical and health professionals of the institution with the community-based healthcare program. Excuse me. Sure. The Unimed vision mission statement, then we'll take a historical perspective by way of background, looking at the public health, the Office of Medical Officer of Health, the concept of preventive and social medicine, primary medical care, community nurse midwives, and community medicine, as well as primary health care. Then we'll consider, excuse me, please. Sorry, please. We are done with this. So the outline, please. Then I'll look at integrating medical and health professionals into the community-based medical care of the university. Talking about the Unimed vision mission statement, please. That's about the 4th slides, please. The Unimed vision made it categorically clear that community entrepreneurship and community-connected medical and health sciences university that responds to the need of the 21st century. And the mission statement is to promote integrated educational and research of exceptional quality. It is also meant to as of the university. And the Unimedth law, the law establishing the teaching hospital, also has this section 4.1d of the law, which as one of the functions of the teaching hospital, which is involvement in community health mobilization and health information dissemination. So by way of background, looking at where we are coming from, we officially, public health came to be in about 1374 at Venice, a city in northeastern Italy, following the epidemics that were recorded in that city, after the birth shift departs, and which spurred the need to begin to ask the ship to obtain certificate of no epidemics from the ports where they left, and which succeeded in curbing the epidemic outbreaks that were being recorded during that period. That's just in brief the start of public health. And by 1847, the Office of the Medical Officer of Health was established. Before this time, we had a number of reforms, the sanitary law reform, the poor law reform, the prison reforms, and the sanitary inspection, the instituting sanitary inspectors in the health system. And by 1847, the need to have a medical officer, because up to that time, those functions were being provided by largely by non-medical personnel, and at more or less parallel form. And it became necessary to have a professional that can be able to coordinate this range of services and provide them at the community level at a one was appointed as the first public health medical officer of health in 1848 for London, John Simon, and that established the office of the medical officer of health. Community nursing and midwifery came to oversee and provide care at home level for his wife and the poor ones, and observe that that step was quite effective.
you.